Before pharmacies reached the American Southwest, there were curanderas, the only medicine their communities had. Number 19 treated the same condition as metformin 60 years before metformin existed. Number 8 contains a compound pharmaceutical companies have been trying to patent since 1994. These are 25 Mexican curandera cures that healed the American Southwest before modern medicine arrived. Number 25. Flor de Jamaica for blood pressure and inflammation. The deep crimson flowers of Hibiscus sabdarifa, Jamaica, as every Mexican household calls it, were brewed into the cold, tart drink that appeared at every meal and every gathering, sweet enough that children asked for it without knowing they were drinking medicine. Hibiscus contains anthocyanins and organic acids with confirmed anti-hypertensive effects. A 2010 randomized controlled trial in the Journal of Nutrition found hibiscus tea significantly reduced blood pressure in adults with pre-hypertension. The curandera who gave Jamaica tea to elderly relatives with high blood pressure had the correct treatment 3 decades before the clinical trial confirmed the mechanism. Number 24. Epazote for intestinal parasites. The pungent herb that every Mexican cook adds to black beans for its flavor was understood by curanderas as medicine long before anyone called it a culinary ingredient. Ascaridole, the primary volatile compound in epazote, is directly toxic to intestinal parasites, including roundworm, hookworm, and amoeba. American pharmaceutical chemists isolated ascaridole in 1895, and it was used as a commercial antiparasitic drug until synthetic alternatives arrived in the 1940s. The curandera who added epazote to food for families with parasite complaints was administering an active pharmaceutical agent that the formal medical establishment would later synthesize and abandon in favor of something patentable. Number 23, Gordolobo for cough and bronchitis. Nephallium species, the low silvery-leafed plants called gordolobo across northern Mexico and the American Southwest, were the curandera's answer to every chest complaint that came through the door. Dried and steeped into a tea sweetened with honey, the preparation soothed irritated airways and loosened stubborn congestion. The plant contains flavonoids and terpene compounds with confirmed expectorant and anti-inflammatory properties in respiratory tissue. Number 22. Damiana for energy and mood. Ternera diffusa, the small-leafed aromatic shrub of the Sonoran and Chihuahuan deserts, was the curandera's tonic for the exhaustion that came with hard physical labor, inadequate food, and lives spent in conditions that depleted everything. A tea of the dried leaves, given daily for 2 weeks, restored what healers called the vital force, the willingness to get up and continue. Modern pharmacology has identified damianin, gonzalitosin, and related compounds with confirmed effects on the central nervous system, including mild anxiolytic and mood-elevating activity. A 2009 study documented significant adaptogenic properties. Number 21. Hierba del Manso for wounds and skin. Anemopsis californica, yerba mansa, the low-growing plant of alkaline wetlands and stream banks throughout the desert Southwest, was the curandera's all-purpose wound medicine. The root, prepared as a tea or poultice, was applied to infected wounds, used as a gargle for throat infections, and given internally for urinary tract complaints. Number 20. Quachalolate for stomach and liver. Amphipterygium adstringens. Quachalolate, the rough-barked tree of Mexican dry forests, was one of the most important medicinal barks in the curandera tradition for stomach ulcers, liver complaints, and the chronic digestive pain that poor diet and stress produced in working communities. Modern research has since confirmed that quachalolate contains anacardic acids and pentacyclic triterpenes with direct activity against Helicobacter pylori, the bacterial pathogen responsible for most stomach ulcers. The ulcer medicine that curanderas prescribed for generations was hitting the correct molecular target. Number 19. Nopal cactus pad for blood sugar. The flat green pads of Opuntia cactus, nopal, appeared on the Curandera's medicine shelf and the kitchen table simultaneously because the Curandera tradition rarely separated the two. For patients showing the excessive thirst, fatigue, and slow wound healing that indicated blood sugar problems, nopal pads were prescribed as daily medicine, grilled, juiced, or eaten raw. The plant contains pectin and other soluble fibers that slow glucose absorption in the intestinal tract, along with compounds that directly stimulate insulin-like activity. A 1988 study in diabetes care confirmed nopal significantly reduced blood glucose in patients with type 2 diabetes. The curandera who prescribed nopal for sugar sickness was using the correct treatment 60 years before metformin became the global standard. Here is what the curandera tradition actually was and what it was not. It was not folk medicine in the dismissive sense that phrase carries. A curandera in a border community in 1900 might serve 500 families across a territory that had no physician within 2 days' ride. She trained through years of apprenticeship, learning not just which plants to use, but how to prepare them, at what doses, and for which specific presentations of a condition. The pharmacological accuracy of what she knew is what research has been confirming for 40 years. 18 more. Number 18. Cola de caballo for kidney and urinary complaints. Equisetum mexicanum, horsetail specific to Mexican and southwestern practice, was the curandera's diuretic and urinary tonic, given for kidney stones, urinary tract infections, and the water retention that came with kidney stress and poor diet. The silica compounds and flavonoids in horsetail have confirmed diuretic activity and mild antimicrobial properties in the urinary tract. Research has also confirmed horsetail's role in supporting bone mineralization, consistent with traditional applications for fractures and joint complaints. Number 17. Hierba santa for digestion and fever. Piper auritum, the large heart-shaped leaf that smells unmistakably of anise and wraps tamales in Oaxacan cooking, was a medicine before it was a culinary wrapper. The curandera used the leaves for fever, for the digestive complaints that rich or contaminated food produced, and as a topical poultice for skin infections and joint pain. The curandera preparation used the leaf at culinary doses as food medicine, and at those doses, the anti-inflammatory and antispasmodic activity of the plant's flavonoids was the operative pharmacology. Number 16. Ruta for muscle pain and headache. Ruta chalapensis, rue in the Mexican tradition, was the headache and muscle pain remedy the curanderas applied externally as a poultice of fresh bruised leaves pressed against the temples or the site of pain. The volatile compounds in rue include rutin and bergaptan, with confirmed anti-inflammatory and antispasmodic properties. Applied externally in the traditional preparation, not taken internally, rue provided genuine topical relief for the tension headaches and muscle aches that physical labor produced daily. Number 15. Guava leaf for diarrhea and diabetes. Psidium guajava, guava, the fruit that every child in a Mexican community recognized, had a second life in the curandera's medicine chest that the child eating the fruit probably did not know about. The leaves, boiled into a strong tea, were the curandera's first response to severe diarrhea and to the blood sugar management that nopal cactus supported from a different angle. Guava leaf contains quercetin and other flavonoids with confirmed anti-diarrheal activity through direct inhibition of intestinal smooth muscle spasm and confirmed alpha-glucosidase inhibitory activity that slows glucose absorption. A 2010 study in nutrition and metabolism confirmed guava leaf tea significantly reduced post-meal blood glucose in type 2 diabetic patients. Here is the number that frames the curandera's position in American medical history. Between 1848 and 1900, the Mexican-American population of the Southwest had almost no access to licensed physicians. not because physicians did not exist, but because they did not serve these communities as a matter of practice and often policy. Into that void, the curandera was not an alternative to medicine. She was the only medicine available to millions of people across Texas, New Mexico, Arizona, and California. Number 14. Tronadora for diabetes. Tacoma stands, yellow bells. Tronadora, the bright yellow-flowered shrub that grew along arroyos and canyon walls throughout the desert Southwest, was the curandera's diabetes plant before anyone called the condition diabetes. Given as a daily tea to patients showing excessive thirst and fatigue, it was prescribed specifically for what healers described as the sugar illness. Number 13. Artemisia for fever and menstrual complaints. Artemisia ludoviciana, white sagebrush, Artemisia, was the curandera's fever herb and women's medicine throughout the American Southwest. Used as a steam bath for fever, as a tea for menstrual irregularity and cramping, and as a poultice for headaches, the plant was in the medicine kit of virtually every curandera working the border communities. Camphor and cineole in the volatile oil have confirmed antipyretic and antispasmodic properties. The connection between the Mexican Artemisia tradition and the mugwort tradition of Asian medicine is striking. Two completely separate botanical traditions on opposite sides of the world, arriving independently at the same genus for the same applications. Number 12. Copal resin for respiratory illness and wounds. Bursera species, the trees that produce the aromatic copal resin used in ceremony and medicine throughout Mesoamerica, provided curanderas with a wound sealant and respiratory treatment that predated European contact by centuries and continued in use through the 20th century. The resin, burned as incense in sick rooms, delivered terpene compounds with confirmed antimicrobial properties through inhalation. Applied directly to wounds, it created a waterproof antimicrobial seal that prevented contamination during daily work. The ceremonial and medicinal use of copal were inseparable, a healing practice understood as both physical and spiritual simultaneously. Number 11. Mesquite bark for wounds and digestion. Prosopis species, mesquite, the thorny nitrogen-fixing tree of the Chihuahuan and Sonoran deserts, was the curandera's tannin source for wound washing and diarrhea management. The inner bark, boiled into a dark astringent solution, cleaned infected wounds through the same tannin mechanism as oak bark and persimmon. Number 10. Malva for throat and urinary complaints. Malva neglecta, common mallow, was one of the most widely used mucilaginous plants in the curandera tradition, applied for the same reasons as marshmallow root and slippery elm in other traditions, because the thick gel produced when the leaves and roots are steeped in water physically coats inflamed tissue and allows it to heal. Used for sore throats, for the burning of urinary tract infection, and for the stomach pain of gastritis, malva was the curandera's demulcent of first resort in communities that had access to the weedy plant growing in every disturbed soil and garden edge. The mechanism is not chemical, but physical, a protective layer over inflamed tissue. The most basic pharmacology is sometimes the most effective. Number 9. Pinon pine resin for wounds and chest. Pinus edulis, the pinon pine of the high desert Southwest, produced the thick aromatic resin the curanderas collected from bark wounds and stored for the medical emergencies that required an immediate antimicrobial wound sealant. Applied warm to cuts and abrasions, the resin hardened into a protective barrier. Inhaled as steam, it opened congested airways. The terpene compounds in pinon resin have confirmed antimicrobial activity, the same chemistry that makes pine-derived products the basis of commercial antiseptics. Number 8. Hierba del Cáncer, Quachalolate bark. Returning to Quachalolate for the fuller story of what makes it genuinely remarkable. The bark that curanderas prescribe for stomach complaints contains anacardic acids, the same family of compounds found in cashew shells that have shown significant activity against cancer cell lines in laboratory studies since the early 1990s. Pharmaceutical companies have been investigating and attempting to patent anacardic acid derivatives since 1994. The curandera who used quachulalate bark for stomach and liver complaints was working with a plant whose chemistry is now the subject of active oncological research. Number 7. Canela for blood sugar and digestion. Cinnamomum verum, true cinnamon, canela, arrived in Mexican medicine through the colonial Spanish pharmacopoeia, but was adopted into the curandera tradition so completely that it became inseparable from it. Given as a daily tea for digestive complaints and blood sugar management, canela was prescribed specifically for the patients showing signs of sugar illness as a complement to nopal and tronadora. Research has confirmed that cinnamaldehyde in cinnamon improves insulin sensitivity and reduces fasting blood glucose. A 2013 meta-analysis of 10 randomized controlled trials found cinnamon supplementation significantly reduced fasting glucose and total cholesterol. Number 6. Anis estrella for colic and respiratory illness. Illicium verum, star anise. Anis estrella was the curandera's pediatric herb, given specifically for the infant colic that made crowded household living more difficult, and for the respiratory complaints of children working and playing in dusty southwest conditions. The anethole content delivers the same antispasmodic activity as fennel and anise, confirmed in multiple studies for gastrointestinal smooth muscle relaxation. Star anise also contains shikimic acid, the same compound used as the primary raw material for synthesizing oseltamivir, marketed as Tamiflu. Number 5. Verbena for fever and nerves. Verbena officinalis and related verbena species, the low-growing plants that curanderas called verbena or hierba de San Juan, carried a dual application across the Southwest healing tradition. Fever management and the nervous complaints that overwork, grief, and uncertainty produced. Used as a hot tea to promote sweating that broke fever, and as a calming preparation for the anxiety that accompanied serious illness, verbena provided 2 different pharmacological effects from the same preparation, depending on whether it was given hot or at room temperature. Verbenin and hastatoxide in the plant have confirmed anti-inflammatory and mild sedative properties. Number 4. Huizachi flowers for skin and respiratory illness. Acacia farnesiana. Huizachi, the fragrant thorny tree of the southwest lowlands, provided the curandera with flowers rich in terpene and flavonoid compounds applied as a steam inhalation for respiratory illness and as an infused oil for skin conditions. The flowers contain compounds with confirmed antimicrobial and anti-inflammatory properties. The perfume industry prizes Huizachi flower extract for the complexity of its aromatic profile. It is one of the most expensive natural fragrance ingredients in commercial perfumery. Number 3. Desert willow for respiratory infection. Calopsis linearis, the desert willow, whose long trumpet-shaped flowers lined every dry wash and arroyo in the American Southwest, was the curandera's treatment for persistent respiratory infection and the fungal lung conditions that desert dust caused in vulnerable patients. The bark and flowers contain compounds with confirmed antifungal activity against Candida and other fungal pathogens, including the coccidioid species responsible for valley fever, the fungal lung infection endemic to the Sonoran and San Joaquin Valley dust zones. A 1992 study documented desert willow's significant antifungal activity. The curandera prescribing desert willow tea for the dry, persistent cough that came with desert dust exposure was treating a condition that modern pulmonology still struggles to address pharmacologically. Number 2. Manzanilla in the curandera's specific preparation. Every Mexican household knew manzanilla, chamomile, as a stomach tea. The curandera knew something more. The preparation she used was not the gentle tea of ordinary household use, but a concentrated double infusion given for the acute gastric inflammation that indicated something more serious than common indigestion. Apigenin and chamomile at higher concentrations has confirmed mucosal protective effects and direct activity against Helicobacter pylori, the same pathogen that quachalolate targets through a different mechanism. The curandera who prescribed both quachalolate and concentrated manzanilla for the same patient with persistent stomach pain was addressing H. pylori from two separate pharmacological directions before anyone had identified H. pylori as a pathogen. Number 1. The curandera herself, what the American Southwest lost when she was no longer needed. The curandera tradition did not fade because it failed. It faded because pharmaceutical advertising in the 1950s and the 1960s, combined with the first generation of Mexican-American families able to afford physician visits, reframed the curandera's knowledge as something to be embarrassed by rather than preserved. Within 2 generations, knowledge that had been primary care medicine for millions of people was reclassified as superstition. The Damiana and Epazote and Nopal and Tronadora and quachalolate that researchers are now patenting and studying in laboratories, that knowledge lived in the memory of women who were never paid for it and almost never asked what they knew before they were gone. 25 remedies from a healing tradition that kept the American Southwest alive for 4 centuries. Walk into any Mexican market this week and look at the herb section. Every bundle hanging from the ceiling, every packet on the shelf. That is a curandera's pharmacopoeia, still available, still priced for the communities that always needed it. Subscribe to Forgotten American Ways. The knowledge is still there. The question is whether anyone asks for it before the last curandera is gone.